Let us consider a study that examines the impact of using blood thinners on patients who have undergone CPR. Cardiopulmonary resuscitation, or CPR, is a procedure used on individuals suffering a heart attack when other emergency resources are unavailable. This procedure is helpful in providing some blood circulation to keep a person alive, but CPR chest compressions can also cause internal injury. Internal bleeding and other injuries that can result from CPR complicate additional treatment efforts. So, for instance, blood thinners may be used to help release a clot that is causing the heart attack once a patient arrives at a hospital. However, blood thinners negatively affect internal injuries. So here we're going to consider an experiment with patients who underwent CPR for a heart attack and were subsequently admitted to a hospital. Each patient was randomly assigned to either receive a blood thinner, the treatment group, or not receive a blood thinner, the control group. Now, the outcome of variable of interest was whether the patient survived for at least 24 hours. So let's start off, let's form hypotheses for this study in plain and statistical language. And I'll use P sub C to represent the true survival rate of people who do not receive a blood thinner. That is, the proportion of survival for the control group. P sub T will represent the survival rate for people receiving the blood thinner, which is the proportion of survival for the treatment group. All right, so the null hypothesis is always going to be the no difference hypothesis, that there's no difference between the two groups. In this case, there is no difference in the true survival rates for people who do not receive blood thinner and for people who do receiving blood thinner. So the proportion for the treatment group minus proportion of the control group equal to 0. The alternative is that there is a difference in the true survival rate for people who do not receive a blood thinner and for those who do. So the proportion from the treatment group minus the proportion for the control group is not equal to 0. All right, here are the results of this study. There were 50 patients in the experiment who did not receive a blood thinner and 40 who did. And you see the results. So the question is, what is the observed survival rate in the control group and in the treatment group? And then what's the point estimate between them? So for the treatment group, you can see 14 survived out of 40. So the proportion from the treatment group is 14 out of 40, which is 0.35. The control group was 11 out of 50. So the survival rate for the control group was 11 out of 50, or 0.22. The point estimate would be subtracting those two. So 0.35 minus 0.22 gives you a point estimate of 0.13.